started. I wanted to say hello to everyone, and we're so excited to have you here for PQMD's two-session event called Warming Up to Cold Chain. We have coupled together today's webinar style event with a second session next week at the same time, March 2nd, where practitioners and peers will actively work together with one another towards building best practices and wrestling together with identifying needs for growth. We're delighted to bring you these two sessions. As you're coming in as part of the audience, if you would please mute your microphone and keep your camera turned off, it will help to highlight the speakers in the session. So I'm Julie Marie Vanderberg, PQMD's Senior Director of Global Health, and along with our entire team at PQMD, I wanted to welcome you today and thank you for joining us. I do see a lot of members in the room, but in case you're new to us, PQMD is a global alliance of international NGOs and leading healthcare companies that are committed to advancing the role of quality product donations worldwide and access to medicine initiatives. As an audience, you guys are a diverse and international group too. If you could please go ahead and let us know your name and your organization by typing in the chat box and potentially even where you're calling in from today, that would help us. Next, we wanted to start off with a really quick question to ask you as an audience, and would also add to the quality of our discussion today. Jen, can you put up that question? We just wanted to know a little bit about your interest in the workshop. Is it possible that I'm just not seeing it, Jen?
It's up.
It's up. Okay, I'm going to keep talking then. Well, you guys are, thank you very much. Well, you guys are filling that out. I'm just going to quickly review some rules of engagement. As I said before, it is a large audience, and because of the format is like a webinar, if you guys could just keep your microphones muted throughout the entire presentation. And the panelists, we'd like you to please stay on camera, but also mute when you're not talking. That'll help with the tech and the consistency of the feed. So feel free to type any questions in the comment box or in the chat box at any time. We likely won't get to all of your questions today, but luckily we have our session next week, so we'll gather your input for the workshop session. Also, we'd love for you to join us moving forward on our community of practice. It's an online space for information and networking. We'll drop that address in the chat box as well. Lastly, we just wanted to alert you that we are recording the session, and it will be available on both our COP and our website after the event. I am not able to see the polling for some reason. Oh, Jen, can we see what the results are?
Yeah, it's up on the screen. No one can see it?
Maybe it's just me. Can you guys see it?
Yes.
Okay. Well, somebody, I don't know why I'm not seeing it. Yeah, well, when I jumped on it, it said my polling had been disabled. I think we share a login. So that's great though. Thank you. Can somebody, since I'm a little blind, help me out with what do we have for the majority?
Okay, you know what, Julie Marie, I'll put it back up in a second, okay? Let me just troubleshoot it first.
Okay, so now I have the pleasure of turning it over to our moderator, Dan Neal. He's a specialist in international logistics, humanitarian distribution networks, and Kansas City barbecue. Dan is Vice President of Operations at Heart to Heart International, where his everyday experience in inventory control, emergency response, and management of teams, programs, and relationships improve quality access to healthcare services and medicine. Professional vision is complemented by a unique and lasting personal awareness of the tremendous gaps in quality and care, quality healthcare that exist around the world. He grew up in Papua New Guinea, the child of medical missionaries. Dan, it's been a real pleasure to work with you on this, and thank you for all the time and thought that you put in over the last few weeks to produce these sessions. I'll hand it to you.
Julie Marie, it's been great to work with you as well as and all of our panelists here. So just wanted to jump off here. In the last 5 years or so, about half of the new products that the US Food and Drug Administration has approved were cold chain products. So I think most of us are probably familiar with the needs for cold chain related to things like vaccines or insulin. But a lot of these new drugs are treating everything from migraines to cancer and even recently the Ebola. And all of these products are cold chain related, either the 2 to 8 degrees Celsius or cryogenic or ultra cold. At a basic level, cold chain distribution is really just the extension of the good manufacturing practice, or GMP, environment that all drugs and biologics are required to adhere to. However, the difference with cold chain is that the temperature range for transportation and storage can be quite narrow, just 6 degrees in many cases. And a temperature excursion can result in a product that is ineffective, or in some cases even dangerous to the patient. So on the one hand, we have these tremendous life-saving drugs, and on the other hand, a very challenging transportation, storage, and handling environment. And as organizations who are committed to improving healthcare and health access around the world, how do we navigate this space? So fortunately, we have with us today a great series of panelists who are going to help guide us as we investigate this subject. And so I want to go ahead and introduce our panelists now, and then we will begin our discussion. So Thomas Teague is our first panelist today. He's the president and CEO of Direct Relief. He's been the CEO and president of Direct Relief since October of 2000. Since his arrival at the organization, Direct Relief has provided more than $120 million in grants and more than $8 billion in essential medicines, equipment, and supplies to support health services for low-income people in 100 countries around the world and in all 50 states. We also have with us Moeen Tahir from the Partnership for Supply Chain Management. Moeen has a wide range of experience within the logistics and freight forwarding industry. This experience includes project management, supply chain management, value-added services, training, coaching, and continuous improvement with lean tools and methodologies. We have Rob Norland with us from Amgen. Rob has worked in the biotech and pharmaceutical industry for 18 years or more, with a focus on partnerships and quality. He's conducted quality audits around the world in places like Colombia, Japan, and Europe, and currently manages quality relationships with cold chain transportation service providers at Amgen. And finally, our last panelist today is Lena Atat from Anera. She's a pharmacist and is the Gift in Kind program coordinator. She has 15 years of experience in healthcare, in pharmaceutical production, pharmacy management, pharmacy supply chains, and she oversees Anera's humanitarian aid program in Lebanon. In the last year alone, Lena has managed about half a dozen shipments of cold chain product into Lebanon. So thank you so much, panelists, for being here today. We look forward to hearing you. My first, starting off here, Thomas, we want to have you start us off. In recent years, Direct Relief has made a great investment in this cold chain area, cold chain capacity in your facility and the partnerships that you've been building. While it's pretty relevant right now due to COVID-19 and the vaccines, you actually started this process years ago, before COVID even became an issue for us. So can you talk to us today about sort of the urgent trends in global health that have sort of compelled and enabled Direct Relief to invest so deeply in cold chain capacity? And what are the key considerations that you've had to make as an organization along the way?
Well, thanks, Dan, and everybody. Hey, how's it going? I had anticipated not going first and concurring with everything that Rob Norland said from Amgen. So thank you for the setup. But I think, Dan, you said, well, what we saw, it was sort of hiding in plain sight. I think just the way the trend is going, I guess we recognize that there were really two concurrent things. The absence of a commercial driver to build out, forget about cold chain, just a road, in a lot of places where Direct Relief works. I mean, if there's not a business case to do it. If there's not, if it's not an investment in future profitability, there's really no business reason to do it. So then you're left with, well, who's going to do it? Governments or nonprofits, right? And you're talking about a big investment in creating a distribution mechanism generally, but specifically for medicines, which is kind of a subset of broad distribution, right? So in a lot of places, there's still not ready access to things that have been around for 100 years, right? Aspirin. There's not a compelling business driver to the sales, incentive isn't there. The kind of the purchasing power isn't there. So as a consequence, there's a dearth of investment to build out kind of a distribution mechanism that would enable commerce to flow. That general kind of challenge is particularly acute when you get into more advanced logistics and distribution, that requires power, requires information. So for all the reasons you said, all the new investment, the forward-looking investment in where medication therapy is going, biologics, vaccines, personalized medicine, it's predicated on the existence of power, transportation, cold storage, and access to technology. So you can kind of do the validation to make sure the product got there. And it was clearly lacking. I mean, just the basic distribution, as many of the PQMD members know, that's why they exist. If there's a good business reason to do it, it would have been done already, right? So I think there's often not a good business reason, but a very strong human reason to do, what we groups do. So I think you figure it out. I think with respect to cold chain, I think the best thing that we did at Direct Relief was probably 15 years ago said, we'd always been licensed in California as a wholesaler. So we could, distribute to Tanzania, but not Texas. We could export, but not do it. And I think we recognize that, the distribution of medications is a highly regulated industry, including in the United States, right? And if we couldn't do it in our own country, what business did we have trying to do it in some other country? It's almost, kind of patronizing or insulting, if you can't do it in your own country, right? So that led us, that was Hurricane Katrina motivated. We saw the exposure of kind of, how could this happen in the United States? So we recognized, well, gosh, someone better do it. It's done very well commercially, and it's done relatively poorly outside of the commercial lanes, as we've seen in the past year in the US with respect to distribution of public health commodities, including, PPE and things that aren't really subject to heavy regulation. So I think that those broad recognitions got us, we got accredited in the United States. That was really reassuring to many of the countries that we work in, that it's not something we don't do broadly throughout the United States. But cold chain was always sort of lurking there in the background, and the trend that you mentioned about all the investment, where the new drug therapies were going and all the research dollars were going, it was clear that was, going driven by a number of factors, but including the viability of getting those products to the people who will need them. And in a sense, all that development presumes the existence of a coherent distribution system to get them to people. That assumption is just not valid in a lot of the world. So we kind of recognize that sort of in that, the information was available, the recognition was obvious. It took us a while to internalize it. And we thought, someone should do that, someone should really do that. And then after a few years of kind of whining, we thought, I guess we should try that. So, we'd already become at the time, a verified accredited wholesale distributor, which kind of we thought no one knew what it meant to be a VAUD accredited distributor from the National Association of Boards of Pharmacy, but it was like, a badge of pride for Direct Relief, because it meant that we had the same licensure and credentials as Cardinal Health and Amerisource and McKesson. And we thought that was really important. When we got into cold chain, we looked again to, there wasn't really a standard to follow. I think we adopted kind of, sadly, because the bar was very high, the Amgen. And we thought if we could meet Amgen standards as a commercial distributor, that's the marker. Okay, that took 10 years after we'd become an accredited drug distributor. So we were accredited to, as I think the first nonprofit stupid enough to try it in the United States. It took 10 years before we could have Rob and his team say, close, but keep going, So the level of just becoming an accredited distributor in the United States, which is highly regulated of drugs, is kind of the threshold. But to handle this evolving kind of norms with respect to cold chain, it's a niche within a niche, I think. And as Rob will, first of all, correct any of my misstatements and then explain much better than I'm able to, I think the basic issues that you've flagged, Dan, it's got to all work or it doesn't work at all. I think it's got to be manufactured in very tight controls. It's got to be from the point of manufacture to the point of administration. It has to be controlled and documented that it has been controlled within range throughout the entire supply chain. So I think what we learned going forward was just all those pieces that are involved, from kind of the cold shippers, the packaging materials, the handling and packaging within your site in cold storage facility, all the requirements of a cold storage facility, including redundant power, without which, high risk of disaster. And, I think that power availability loomed large. We're have started kind of almost a subdivision of power availability for health, because what we saw in Puerto Rico, it happens in California. Power is a prerequisite for modern healthcare, period. And if you don't have power, you don't have, in the United States, electronic health records. You don't have refrigeration. You don't have a lot. We saw it in Puerto Rico. We put in power, refrigeration, and pharmaceutical grade freezers in every health facility on the island. So I think it's been a recurring kind of pattern of recognition. But the issue, you said it well, it's hiding in plain sight. Is it where it should be? No, particularly for the public health reasons. We're living through it right now. Richest country in the history of the world does not really, we screwed up PPE, for God's sakes, in the United States. The commercial channels are, I think it's just where they are. I think the standards have been set in the commercial sector. And it's a long drop, a big gap between what is done well in that competitive field every day and what governments or non-governmental organizations do, because they don't do it every day and they don't have the type of investment. So I think that looking forward, unless it gets solved, unless costs come down, unless quality goes up, the sad fact is the cleavages that exist in the world are going to get way worse. Poor people will not benefit from the advances in science unless this basic distribution issue gets addressed. So that was the motivation to lean into it. It's expensive. Packaging is hundreds of dollars per box. The conditioning of the material, there's a lot involved. But the payoff is that the drugs work. They save your life, and it would be a real tragedy for our species if the only people who benefit from the scientific advances are people who live in rich countries. And I think that's what PQMD members, and we're one of them, is that's why we've leaned into it. So I'll stop there. And again, we'll therefore welcome Rob's corrections and then concur with everything he says. And thank you. And Lena, and what ANIR has done, I think, in Lebanon after the bomb blast, they nailed it. We sent Humira, I think, one of the contributions. So people who are having to figure it out and doing it well, God bless you and thank you for what you've done.
Great. Thank you, Thomas. Rob, really the next question is for you, and you can obviously correct Thomas as much as you need to. So you represent Amgen, manufacturer of biologicals, cold chain products. You're a quality auditor. You manage significant relationships between Amgen, other pharma companies, nonprofits like Direct Relief, supply chain the transportation companies that you work with. Yeah. When you think about putting Amgen's product into a humanitarian supply chain in the developing world, what are the sort of organizational characteristics and values that that you're concerned about or able to point to as, hey, that organization is going to be successful managing our product?
Right. Well, first, let me start by saying thanks for the opportunity to come here. It's great. Thomas, you nailed it on the head. And really, Amgen can learn a lot from your organization and other organizations because you have boots on the ground right there in the midst of everything. And we're not able to do that in a lot of cases. So I think, you know, the learning goes both ways. It's very much, thank you for that. You know, as far as partnerships, Amgen's pretty new to the whole humanitarian working with external partners in the humanitarian realm. You know, we work well in the clinical and commercial settings, and we have supply chain set up very succinctly, very tightly. And I think that, you know, one of the things that we learned with, because direct relief was really our first partnership in the realm where we're going to end up taking product donations and get them to places that we've never been before. And so in hindsight, looking at the characteristics of companies that we want to work with, you know, at first when we went to direct relief, I'm just going to go right to you, Thomas. And we went to their facility as they were transitioning from an older facility to a newer facility. And I just have to, you know, say from a facilities like a GDP, GMP type of facility, it was very, it didn't quite have the capabilities that we were looking for as far as cold storage and control around temperature and the, you know, the validation package between or for the freezers and the refrigerated units that were on site. But then you were building that new facility, and we came back and things were state of the art. It was extremely impressive, and that's, I found out that's just the first step. And a lot of our product donations never even went to that warehouse. So we had to, I think the biggest key takeaway is that we want to work with organizations that understand the supply chain. It's pretty easy to get product from the United States to Europe or other major continents, but it's that last, quote unquote, last mile that needs to be more well understood. What's the capability of the transport service provider from that destination into the country, say the airport or what have you? How do we get it to the healthcare providers in that country? And you know, what kind of truck is it? Is it secured? Are there two drivers? Are there one driver? Are they making stops? Is there a stop layover along the way? There's a lot of things to consider from a product quality standpoint, as well as a product security standpoint, which, as Thomas mentioned, you're looking at some doses can be hundreds of dollars a piece. So you could be looking at thousands and $100,000 worth of product that's very attractive for a thief to steal and then make money off of. So that's what we're looking for. Is we're looking for complete supply chain understanding and control. And you know, I think we've had some lessons learned for some of our first shipments that we worked together, Thomas. You know, some of the products weren't handled appropriately at the end of the chain and ultimately had to be destroyed. But that goes back to another component that's really important, and that's traceability and tracking of every single unit. Everything should be accounted for. And you did it. It was pretty impressive. And I think that first shipment went into 7 countries and then just disseminated from there. So, you know, at the end of the day, we're looking at GDP compliance. We're looking at control of the supply chain and understanding of where the product is going to go and what kind of a relationship do you have with that end user? Do you know what's really going on there? You know, is a product sitting on the counter, you know, for a day before it gets into refrigeration or what have you? Like what Thomas said is Amgen's products and other pharmaceutical products that are biologics have a specific window of expiration based on, you know, ongoing studies that we perform that are very technical as far as, you know, being able to, when you pack it for shipment in an insulated shipper, you have a certain amount of time to do that, and you have to record the time out of temperature so that you know when it gets to the destination. If there is a temperature excursion, you can go back and look at what's the estimated time out of refrigeration in order to know if the product is still good or not. So there's a very detailed understanding of the supply chain is very important. And I think that's really some of the characteristics that we're looking for in partnership.
Great. Thanks, Rob. So Lena, you represent, at least for our panel today, that last mile that Rob is referencing. Your clinics and your hospitals that you support in Lebanon and Gaza and the West Bank, you know, that's the final link in the chain. What are the steps that you have been able to take to ensure that that last mile is completed, and that the products, when you receive them from the airport and deliver them to the clinic, that they make it safely into the patients that need them?
First, thanks, Dan, for the introduction. And certainly it's an honor to be with you and to join you and have this opportunity there. Actually, as an era, it's very important to us to check over the end recipients, the end recipient equipping through for cold chain and for the storage capacity at that end. That's done mainly through monitoring or quality visits that we usually do at the last quarter, for example, of 2020. We've succeeded to do around 11 monitoring visits given the lockdown and all the challenges in Lebanon, and the same has been there at West Bank and Gaza as well. Though and given all these challenges, we were able to do that, and because at that period specifically we were accepting the insulin from direct relief. Thank you so much, Direct Relief and Thomas, for that. So we need to check over some of the hospitals and recipients for their proper storage conditions and facilities and the teams, and then every like all the assessment thing or the baseline thing that has to be done at that end. We've also successfully done several visits a week ago with Direct Relief, also visitor who went with us and checked also. We both like together, we went to the facilities and even to some beneficiaries who have received the donations, and we've checked over the modality of dispensing these medications at the level of the healthcare center itself, and also at the level of the beneficiary. That was really great to do. For Humira, for example, the medicine that has been delivered also for West Bank and Gaza. There we've delivered that straight away to the hospital that has accepted the medication. The team had really confirmed and ensured that there are really well-trained staff that to provide these medications. The same is for the donated Cerezyme and Mayozyme from Sanofi to Gaza. It's also worth mentioning at this point that donors' eye on the supply chain, like having these specialized dry ice packages that came with the specific for these donations, specific, for example, for Gaza, given that there are checkpoints, and these medications should withstand around 2 hours in the inspection checkpoints, and all these details, like when we do coordinate as at the field level with the donors, with the end recipient, all this coordination thing, when it's done properly, I think it's safe to deliver all these medications. Now at Anera, we have sharp measures that with our recipients, like when we do like at the level of the distribution center, when we contact the recipients, for example, for instance, to receive their shares, we do make sure to tell them that like the size of the donation, so as they would bring with them the package or to pile up properly the items and to have a good portable refrigerators. And if it comes like if they do forget this, for example, the dry ice, then we have to reschedule the visit again and they're not able to pick up their stuff or their share. So these measures are very important at the field level. And as inspired also by our donors, a new measure that ANERA makes regarding the advances and the challenges actually the challenge is the vetting of the cold chain. Now this is a new, we've already had all the list of the centers who are all the recipients already to ANERA that are eligible also for vaccine providing. So we've now doing a new vetting for cold chain. We've started that since like days ago, and this is inspired also by our donors. Step-by-step tracking. As ANERA, we do have a long team like of pharmacists and medical experts, medical procurement experts, supply chain experts, and long logisticians who would really keep an eye on step-by-step tracking of this cold chain. And from the level of having reviewing the shipping documents up until we have the medication at the recipient level, in addition to the location of the distribution center itself at the central hospital in Beirut, which is also distributing for example, the vaccine as well. In addition to cold chain, they have enough space to store there all the required. In addition to, for example, let's also talk about the new inventory system that is also integrated with the meal system that we are working on. All this should ensure safe store, like safe. This distribution or dispensing of the medication at the level of the end recipient. Yes.
Thank you. Thank you. Moeen, we're going to turn to you next. Your organization's kind of in a little bit of a different spot. The Partnership for Supply Chain Management, you have offices in the US and in the Netherlands, but you serve clients in 85 countries around the world. So when you're sending cold chain product to a country, you don't necessarily have a staff person who works for your organization on the ground there. So how do you go about verifying or vetting the end recipients when you're moving product around the world?
Thanks, Anne, for having us here. At least it's a great platform to talk about some of the pressing issues that comes with the cold chain supply chain. But as you mentioned, at PFSCM, we are working with a lot of countries. So it's actually very important for us to have a process in place, at least to confirm whether the country has a warehouse capacity to handle any supply chain requirements like cold chain. So we do have the checks mainly at two stages. So one is at the very beginning where we receive a request from a country to procure a particular product. And if that product requires special storage condition, then we make sure that the country is well informed, guided about it. Basically, we just reconfirm with the principal recipient that they have the sufficient infrastructure available, staff available before we finalize any of the procurement. Once that is done, then we move on to the next check, which comes which is kind of an important check. And also it comes before the execution of the shipments when the cargo is ready. And it's also a very important part of our supply chain that we know that cold chain shipments are very time sensitive. So we want to avoid any potential delays that can happen during the entire supply chain, especially nowadays with COVID-19 that has caused a lot of disruptions in so many sectors. So for example, we check with our partners how the packaging is done, possible routing options with airlines, airport facilities if they have that. And we also now experience a lot of countries are facing some storage issues in their centralized warehouses. So what we do is we check with our partners on ground. They go and they get the final confirmation from the facility directly, because we want to make sure that when the cargo reaches to them, they are able to receive them, store them as per the requirement. We also have seen that some of the countries are not able to actually manage that. Then we work with the third-party local warehouse providers to reduce some of the pressures on the central warehouses. It has been a very effective strategy for us for 1 or 2 countries where we actually doing that, because at least in that way, we are able to manage those cold chain shipments in a required temperature settings. And also it helps country to manage their last mile deliveries that needs to happen to different clinics and hospitals. So the key factor I think here is the strong collaboration between the stakeholders, because the information is a vital thing, which of course can eliminate a lot of uncertainties that can happen during the supply chain. So I think that's something we do rely on every shipment and requisition stage.
Great. Yeah, thanks. Going back to Rob, I think, so we've heard quite a bit here about the relationships between organizations and how important that information flow is before the product starts to flow. So maybe you could re-emphasize that. So how important are those relationships, and what happens if something goes wrong? I think relationships are pretty key when something goes wrong as well. So can you speak to that?
Certainly. Well, we hope that nothing would ever go wrong, but I would be remiss to say that it never did. So, I mean, the bottom line with a lot of relationships is sometimes you can't always pick who you're working with, because you need to have a specific requirement for a specific region, and there's not that many, there might not be that many qualified vendors or suppliers or service providers in that region. You have to work with them. And I think a key component is finding or meeting a lot of your partners where they're at, and helping to improve upon their processes if need be, or their facilities if need be. Most of the supply chain that Amgen is working with is a clinical or commercial level, so that's very well established. And I think there's a lot that can go wrong there still as well, as Moeen had referred to. You're looking at custom clearances, you're looking at specific documents that are required, regional requirements, and any partner that we work with from a regional level should understand those local requirements and have QPs or RPs on the ground that are able to work with the release criteria of the product into that region, or understanding special exemptions or things like that. So there are many different players that can take place in a donation. Now, we had worked with Thomas on a donation that was coming from our Amgen Canadian facility, and that one, I would say there was a lot that could have gone wrong. And I think the challenges that we had to overcome as far as understanding how to ship the product back from Canada into, I think we were going to Tanzania, if I'm not mistaken. And one of the challenges that we had was our TSP in Canada, where the product was being held, was not used to outgoing Amgen products. It was mostly incoming. And so our shippers that we used were already established from the source manufacturing site. So we had to work with the carrier to be able to bring in new shippers that they don't normally have or have access to. And there was some training that had to happen with packing and labeling, and they had to do all of that. And so I think that leads me to believe that a key component for a partner, whether it be a TSP or a warehouse or somebody, that they have flexibility. They're able to roll with the punches and be able to problem solve as well. And so, you know, that's a key component. And I'm totally not even talking about, you know, GDP compliance, because and the reason why is because I think you can go online and you can find the GDPs and you can figure out, you know, how to implement them at your facility. And I think that's the bedrock. But then, you know, there's these other aspects that are very helpful to have. And when you have a company that is able to communicate and work through problems, that relationship grows stronger, and you're able to get the product to where it needs to go. And I think that's some key aspects there.
Yeah, I appreciate what you're saying about the technical parts of it. The GDP part that's foundational. That's a given, and then there's all of this other stuff that layers on top of that makes it all kind of more complicated. It has to do well as well. So,
I mean, you know, and the bottom line is we want to be able to get product to patients in need, and you know, if we have a whole time, I think, you know, for like an insulated shipper, once we put product in it, the clock starts ticking. We only have a certain amount of time to get it there. So it's extremely important to be able to have all the ducks in the row, all the documentations, you know, even little things like BSE, TSE statements saying that there's no animal derived materials in this, you know, it's, or in some countries they require a halal statement to understand, you know, if there's any components in there that aren't, you know, in alignment with that. And so that's why I think it's critical to have those pieces of the puzzle determined before you even put it on the road, put the product on the road. You know, and at the end of the day, you know, if the product's not good, we can always replace it, but that's a delay, and a delay for a patient getting their medicine that they need, or starting treatment on a regimen that will help them, you know, live. So I think that's what we try to do.
So Lena, turning back to you at this point, in your sort of context, your organization, your programs, what would you say is your biggest challenge as it relates to cold chain, managing a cold chain product?
Yeah, that's actually a very important question. Actually, if we look like from the outside, like or outside the box, like globally with the all cold chain infrastructure and all the repackaging to preserve the integrity of the items and the energy source and demands and all these details, that is also applied to at the field level as well. And as an era, for example, one of the challenges could be, in addition to what I've mentioned, it could be the time lag that it takes from when accepting the offer from the donors up until the shipment arrives to the distribution, to the end distribution place or the end destination. At this time, this time lag, that like some of the other stakeholders might be able to provide these medications, and the needs might change. So we need to do exercise again of like amendments to the distribution plan and checking. Though we have a large network of health like partners and that are assessed and that we do work with. However, this also one of the challenges that might be might pop up on the way. Though this also from the other the other side of the coin, you could see it as an opportunity. Like what happens with us with insulin donation. Like one of the insulin donations we were suspicious to accept because our recipients told us the WHO is thinking of providing this medication. However, our recipients came back like saying, Anera had secured these insulin. Could you please give us an opportunity for other medications in the essential list that we have missed or maybe we've not promised to get? So this gave our like recipients and partners other like opportunity for new medications or other medications in the essential list by saving them and by providing the extra insulin, like going the extra mile and providing these more and more of the insulin types, which might cover around 2 years of the national need around that. So that's very important to mention. Another challenge could be at the level of the coordination regarding the expiry date. As you know, like in the pharmacy practice, we go for first expiry out, first in, first out. So, so first expiry out, so at the level, like some of the recipients might be having these medications with a closer expiry date and will have to dispense it. So this might delay a bit the process of dispensing these medications. However, so this also has to be assessed. Another challenge that could be at the level of the shipping documents, where at the airway bill or the bill of lading, they should have, as it's very important that the donor assigns the temperature, especially when it comes to cold chain. So it has to be assessed on the, so as the shipping line, when the cargo arrives, they do put it in the airport or plug it in when it's at the port. So to put it at the right temperature class or zone, this is very important to be announced. And actually our donors like Direct Relief or Americares, they're amazing at doing that. However, at our level, when we do review for the shipping, review the shipping documents, we do look at this as it's very important to be mentioned and to be there. Actually, these are mainly some of the challenges, like at the distribution level, as I mentioned also, regarding some recipients who might forget to get this dry ice and they're not allowed to get their share. So far, these are some of the challenges that we might face at the field level. However, we've been all working together to have that improved and solved. Yeah.
Thank you. So Moeen, anything additional that you would like to add related to customs clearance challenges for cold chain products, just given, as Rob was mentioning, when you put the product in the box and it begins its journey, the clock is ticking. So any advice or comment on particularly the customs elements of clearing a shipment?
Right. I think I'll echo what Rob and Lena has been mentioning about, because it's going to be a race against the time. Once the cargo is in that specialized packaging, we need to make sure the cargo reaches to that final recipient within the time frame. So in our kind of work, we dealing with two major challenges. So one is like, since these are funded programs, then we need to understand that there's going to be a duty or tax waivers that needs to happen. So we have to work with the principal recipient to ensure that they have all these documentation before we execute any of those shipments, because some of these exemptions can take weeks and in some cases months. And we don't want to be in a situation where the cargo is already at the airport and then now the customer is asking for additional documents. So that is the biggest challenge, that we are making sure that we understand what is the specific requirement for that country. The second part is the clearance, because the clearance can be very different and some countries have different rules regarding different categories of the product. So you really have to understand what are those documents that you actually need. And also you have to involve your stakeholders, principal recipient, to better understand what exactly the country requires in order to import these products. Since we know that these are time-sensitive shipments, so we definitely, and also we don't want to wait at the airport because temporary storage facilities are not recommended, because we don't have the visibility on the control on the cargo. So I think these two things are still like ongoing challenges. We do have cases where we work with our 3PLs. We find a solution where we can clear the cargo upon arrival, maybe do the documentation part later, if that's an available option. But sometimes you literally have to follow all the rules and regulation. Some of the countries have very complicated process, but it depends on how much aware you are about the requirements of those documents. And you have to ensure that the principal recipients are working with the ministries, customs officials, so that there are no hurdles when the shipment arrives at the airport. So this is something we always try to work with our stakeholders at every stage.
Right. Well, I have just maybe one more question here for Thomas, and then we might get a chance to answer a few questions from the audience. I'm a bit of a Star Wars fan, so I have been for a long time. And so a Star Wars character, Master Yoda, has a famous phrase: "Do or do not. There is no try." And this question really is for you, Thomas. Based on what you know and what we've been talking about today, can an organization kinda do cold chain?
Well, sure. You're just going to screw it up. I think it's the number of variables, and as everyone said, I think just the amount of data that has to be managed for one box. You're talking in our case about multiple temperature data loggers in each box. There are $20 each in each carton that we pack, that is taking 5 to 15-minute interval readings of its temperature over the course of 5 days. I mean, and it can extend up to 30 days. There's actually a data limit on how long these things last. So the amount of data that you have to review, and I think as Rob said, if there's an excursion, you have to know not only how long, but at what temperature. And then you have to go back to medical affairs to say, look, is this good or bad? I mean, it's and they have to review that. So the level of complexity associated with, just sticking stuff in a box and calling it good, it's not worth doing. I mean, the risks are too high. The costs are very high. And I think, so there's a lot of reasons not to do it. But the obvious reason to do it is that if nonprofit groups don't do it, or if public benefit, if governments don't do it, it's not going to get done. I mean, the business case just is not there, just like the business case is not there for a lot of longstanding basic, non-cold chain drugs. I think that the evolution of the cold chain, such as it is, it's progressing rapidly. I think the lane validation, kind of the packaging materials, I think the differences in shipping boxes, I think Rob helped us, move from one vendor to another. That was a much more stable product with a different kind of brick that you put into it. But I think the level of training in detail associated with, for example, how to pack a box, you'd think, oh, that's pretty, stick it in there, throw some ice or whatever, some of those frozen bricks. No, it's like a diagram per size shipping carton, right? And depending on the lane that it's going, I mean, it's typically going from Northern Hemisphere to Southern Hemisphere, right? Depending on the routing that you choose, you may actually have a different packaging diagram to put in an additional frozen brick into the package, because it's going to be in transit in Germany during the summer or something like that. And so I think we've had to invest in software that has every potential routing for cold chain cargo. I mean, it's like a whole separate business. So we started doing it as collateral duty, it's sort of assuming it's kind of like everything else. It's much more helpful to look at it as a discrete discipline. It's why FedEx has FedEx Critical. It's why other folks you can see the evolution. There's separate business units that the basics are the same, but the differences are far greater than the similarities, I think, when you get into the detail. So I think it's not worth doing unless you're really going to make a significant investment. It sounds good. It's clearly where the future is going, but it's, if we knew then what we know now, I wonder if we would have leaned into it as aggressively. I mean, the new building was $40 million. It's millions of dollars each year. We'll spend over $1 million this year in cash that just for the packaging materials and the transport, which is 3 times the cost for air cargo. So, I mean, don't do it lightly. I think it's worth doing. And I think the more people who do it will learn things that will bring costs down and quality up. But, if you look, we're working with the World Food Program now. We were the third largest shipper of WFP's capacity behind UNICEF and WHO over the past year. They don't have it figured out for the public benefit activity related to the vaccine. We're not there as a planet yet. I mean, even the kind of the advent of Pfizer being the first out of the blocks in the United States, we were not ready. We worked with the National Association, tried to map out where the -70, really to map out the distribution capacity at -70 in the United States, which is all proprietary among the distributors. But I'll tell you, what we found out is that it was inadequate to cover the 10,000 vaccination sites potentially that you'd need to have. So there's been a rapid production of different types of validated freezers, refrigeration, at all levels. I think the 2 to 8, the refrigerated is fairly straightforward. You get to -20 and then -70, the level of complexity and cost goes way up. And I think probably because it's so current for us, the availability of power is something that it's presumed in the United States. It's just presumed to be a given. It's not. It's not in California. It's not in Texas this week. It's not in Florida in the hurricane season. I mean, so I think that's why we've moved aggressively into kind of the solar with backup power. You got to generate it and you've got to store it for an interim time. And that is a complete surprise. We did it very reluctantly, but almost by necessity, and including on our building, which has a first permitted microgrid in the continental United States, just for that reason, because we could have lost hundreds of millions of dollars of drugs. And, we're seen as critical infrastructure for the state of California and the country now. So I don't think we're there as a country, as a state of California, as the world. And I think the great thing about, I don't want to be discouraging, because I think you've got to have the young, scrappy people figure it out a different way, and, I think that the commercial channels, sometimes they're, cost is no object, and there's a profitability incentive and price flexibility if you can sell it, that doesn't exist. So I think the push for the distribution, what technology, what materials, what packaging can bring cost down and quality up, but without sacrificing the standards, because it's like sending a kid, if you have a baby and you think, I'm going to send this baby somewhere, you almost have to think about it like that. You can't go out of range. You can't get lost. It's got to be like documents. It's got to be fed. And the amount of information associated with where it is, what temperature it's at, where it's going, how long it's been in a certain place, the volume of data associated with that is itself something that the IT departments, you got to get them ready first, because you can't just graft it on. It's a huge lift, but it's an important one to make. And I mean, it sounds hard, but if Direct Relief can do it, it's not impossible. Believe me, we got, so I think that's the good news. It's just the people who do it next will, benefit from all the mistakes we made and learn the hard way. So just do what Rob Norland says and you'll be okay. It might take 10 years, but you'll be fine.
Well, thank you very much, everyone. I wanted to let the audience know that I think what we'll do is send out a couple questions to the entire audience to help us inform our workshop for next week. I do see Jen's got one up there right now. And if you could just take a quick minute to fill that out, that would point us in the right direction to understand which areas you want to focus on for next week. And a huge thank you to Dan, Lena, Moeen, Rob, and Thomas. We're so appreciative of the time that you spent here with us today and all of your insight. Your candid reflections are really important, and your unique perspective along the cold chain continuum really illuminated core strategies, key visions, and consistent stakeholders, all things that are really important. I love the analogy of the baby, the child and the cold chain product. You highlighted logistical compliance and human resource needs that are effectively key and core to operating any cold chain system. And we're going to dive deeper into all of this next week. I've been taking copious notes, and if any of the panelists want to, I'm sorry, any of the audience members want to reach out to me in advance of the meeting, we'd love to have your input as well to make sure it's as meaningful as possible. Just a quick shout out to the Clinton Access to Health Initiative. You guys are here in full force, and we appreciate your attendance and look forward to working together next week. Thank you very much, everybody, and have a wonderful day.
Thank you.
Thank you.